Hi, my name is Sophia Stathis, and this is my Nursing 340 PowerPoint on cultural assessment. So overall in the nursing field, we see a lack of knowledge for cultural assessment, and this is for several different reasons. When you consider the environment that we live in, it is diverse, but it's often very segregated, so sometimes we have a hard time understanding how people from different ethnic groups think and feel. Cultural assessment is also a complex topic which is difficult to teach and difficult to observe in the classroom. Overall, students report a lack of skill set and difficulty obtaining culturally sensitive information. This is going to include students who routinely interact with patients and consider themselves to be empathetic. So what is a cultural assessment? There's two parts to a cultural assessment, and the first one is a cultural self-assessment. So in order to perform this, you need to be honest with yourself about how you think and feel about friends and family from different cultural groups. This is going to help you identify personal feelings and beliefs, and this is going to help you understand the cultural beliefs of your clients. Whenever you're finished with your self-assessment, you're ready for your cultural client assessment. This is where you're going to obtain data regarding the cultural beliefs and practices of your client. It's going to include things like ethnic affiliation, religious preferences, family patterns, food patterns, and ethnic healthcare practices. When we uncover these things, it's going to allow us to provide better care for them. So why is a cultural assessment important? For one, we can see a conflict in care if the patient's ethnic beliefs interfere with our nursing roles. We can also see maladaptive practices or beliefs. For example, if the patient needs hypertensive medication, but they only want to take garlic to control the hypertension, this would be considered a maladaptive practice. Practices that we think may be odd or silly can actually contribute to the patient's sense of well-being and get the patient involved in the care, which we know is always a good thing. It's also important to understand that not everyone from a particular ethnic group thinks and feels the same way. Whenever we understand the patient's cultural beliefs, we can avoid any miscommunication, and it's going to allow us to be a better advocate for our patients. So to relate this to the AACN domains, we can look at person-centered care. Cultural competence is the core purpose of nursing, and it's a foundation which is a basic level of respect for human differences and beliefs. Whenever we uncover this culturally sensitive information, we can tailor the care specifically to each individual person. When we look at system-based practices, we need to understand that we live in a complex system of healthcare, and we need to consider the impact of various factors on diverse populations. We also need to evaluate structural racism and other forms of discrimination, and we need to advocate for the needs of diverse populations. When we look at the cues and competencies, patient-centered care is really profound here. We need to remember that the client is a source of control in the treatment. We need to integrate understanding of multidimensional care. This is going to include the beliefs of the patient, their family members, and different members of the community. We need to uncover values, preferences, and needs in a clinical interview and implement them into the plan of care. And it's also important to communicate these findings to other members of the healthcare team, which goes back to the importance of advocating for our patients. It's all about recognizing that the client is the source of control, and we need to respect their preferences and their values in their healthcare treatment. And this is my reference slide.